So as we've said multiple times, and it's worth saying because it's a sign of respect for the man tonight in the hospital, we don't know exactly why Damar Hamlin collapsed last night. But at the same time, there are concerns about cases like this. Young athletes collapsing on the field of heart problems. And there has been a dramatic increase in this. You're not imagining it. So what is this? Cardiologist Peter McCullough and researcher Pangis Polycretis looked into this trend in Europe, European sports leagues. They found that prior to COVID and the COVID-19 vaccines, there were roughly 29 cardiac arrests in those European sports leagues per year. Since the Vax campaign began, there have been more than 1,500 total cardiac arrests in those leagues, and 2/3 of those were fatal. Does that prove something? We don't know, but you should know that. Dr. Peter McCullough is a cardiologist. He's also the author of Courage to Face COVID-19. He joins us tonight to assess. Doctor, thank you so much for coming on. So this is one of those phenomena that people who use social media are aware of because there are videos of it floating around, but I don't know when the last time I heard, if ever, an American public health authority address this directly and tell people, what is this? Is this real? Tell us your findings from your actual study on this.
The concern here is that athletes at a professional level, Tucker, are carefully screened for underlying heart disease. The leading cause of sudden death on the playing field is hypertrophic cardiomyopathy. The athletes are screened for this. There are rare conditions, genetic abnormalities in heart rhythm that can present. But sudden cardiac death should be a very unusual phenomenon. And as your report indicates, it's extremely unusual in the NFL since the high level of scrutiny. There's a differential diagnosis that doctors go through when this happens. I watched it live, and then I watched the replay as a cardiologist. To me, it looked like he made a hard tackle. There was head and neck impact, but he got up, he clapped his hands, and then he fell over backwards. It looked like a primary cardiac arrest. Everything that was done on the field looked perfect. I think the duration of CPR and resuscitation is going to be in a window where he can have neurologic recovery. The issue is what caused it. And the concern based on our research is that COVID-19 can cause myocarditis or heart damage. The heart damage in some cases can be asymptomatic, and the initial presentation can be a cardiac arrest. There's other things in the differential, genetic abnormalities of heart rhythm disturbance, hypertrophic cardiomyopathy, a spinal cord type of interaction with the heart. But I think the leading concern here is vaccine-induced myocarditis if indeed he's taken the vaccine. And boy, the family, the Bills doctors, and the current doctors at University of Cincinnati Medical Center have a public health obligation to tell us if he's taken the vaccine.
I think that's fair in the coming days. Now, the CDC, it seems to me, since the absolute numbers of heart incidents among young people are dramatically up across the West, and the CDC, as far as I know, has not been honest enough to address this. They sent out a tweet the other day saying, you may be struggling with blood clots if you're a young athlete. I don't remember athletes struggling with young blood clots. It seems to me like they're trying to tell us this is normal. Is it normal for young athletes to have life-threatening blood clots?
We should never have our agencies try to normalize side effects. The FDA says the vaccines cause myocarditis and heart damage. Autopsy studies show it can be and is fatal. The same is true for blood clots and neurologic damage. Our agencies should be protecting the health of Americans, and safety is job one. I'm disappointed that they're minimizing it.
Yeah. I mean, I think honesty is a prerequisite for trust. When people are honest, you can trust them. But when they lie to you consistently, you can't. So we appreciate your coming on tonight. Dr. Peter McCullough, thank you.